Alright guys, welcome to our next event for our Healthy and Disordered Eating series. Our next speaker is Dr. Segal. He's a clinical psychologist and a professor of psychology here and at Weill Cornell. He got his PhD in English at Yale and a PhD in clinical psychology at University of Michigan, and he's going to talk to us on family dynamics and eating disorders.
Hi. Good evening. Nice to see you all. I haven't done a talk like this in a long time, so I'll lay out some things. Feel free to interrupt me with questions. If you want me just to go through the whole thing, I can, and then we'll of course have questions afterwards. Oh my God, I'm on film. And I have to say, this is such a Cornell experience to come out on a Monday and to have students like you who are interested in a psychological issue that have come out to think about it, which I think says a lot about this place and all of you. And I met Jessica several years ago when she took my adult psychopathology lecture, and in fact she came to me last year with the idea of starting this student group, which I think I'm nominally the advisor on. Mm-hmm. I mean, with Jessica, she says she wants to build something, and you say, okay, go build it, I'll sign. Although I remember our discussions really had to do with a certain niche, in other words, to provide information and support for people who may be worried about their own eating, but also really worried about a family member or a friend who you're worried about. And it is this silent epidemic, really. Maybe that's too strong a term. I don't want to be alarmist because it's been around for quite some time. But there is a way in which it really does so much harm. And the culture has been trying to think about it really since the 70s. Maybe we should think of it as 45, 50 years of trying to think about eating disorders and understand it as the culture has been changing. And one of the challenges for clinical psychologists and therapists and social workers and psychiatrists is psychological illnesses like this, and I'm using that word carefully, but these kinds of psychological illnesses are an expression of the culture at a given moment. My grandmother, Doris, who was married to my grandfather, Mo, or Morris Segal, and they must have gotten married, let's see, probably in around 1918 or 19. One thing she really liked about him was that he was stout. Being stout was really kind of sexy. In some ways it meant that you could afford food. I'm not kidding. My mother, who was never very thin, but never particularly heavy, she was very kind of in between. Her grandfather used to say that she looked like a chicken because he wanted her to be heavy, because that was a sign of health and strength. And in fact, if you look at the movie stars from the silent era, they're beautifully round, because that was really hot back then. And so I'm sure women and men had issues with their body and their body image at that time, but it seems to me that the expression of psychological torment had more to do with hysterical symptoms, with other kinds of disorders and ways of expressing it physically than anorexia, which seems to have, again, always been there for a very small percent of the population, but in the mid-60s really expanded. I guess I'm not telling this group anything you haven't heard before. But I remember in my own training, I was 3 years at an adolescent inpatient unit, and we had an eating disorders program, and I had several patients, both adolescent girls, who I worked with, and we really, in those days, we could keep someone 3 or 4 months. And it wasn't a special program. It was that's how long you kept adolescents in the hospital in the 80s. You could actually you could have a real milieu and keep people 6 months. Anyway, I worked in the eating disorder program, and I came home and visited my parents in Manhattan, and I was sitting up late, and the movie Wait Till Dark came on with Audrey Hepburn, and I'd never seen it, and it's a really wonderfully terrifying movie. If you haven't seen it, it's about a blind young woman who's blind, and she has a boyfriend, and he leaves, and then she's terrorized by these hoods, who she ultimately is able to use her hearing to combat them. But the thing was, I looked at this movie and I thought, why isn't Audrey Hepburn in the hospital? She is so in episode, it's just alarming, and I realized the movie was 20 years old, and when that movie came out, no one saw it. No one saw it. It wasn't, I mean, no one talked about it at the time. In retrospect, there's been a lot of discussion about Audrey Hepburn and her nervous breakdowns, which probably were much more about starvation than they were about having a psychotic break or depressive break. And I know you've had some really good speakers. Jessica said that you had someone who does rigorously does work with cognitive behavioral therapy. You've had was it Myrna who came? Or
Myra.
Myra.
From chat.
Who's who I understand really talked about nutrition and eating behaviors and got you all to talk. And when Jessica asked me if I would take one of these nights, I thought family therapy might be interesting for all of you to think about. Because family therapy is considered by some people to be, if not the most effective treatment, one of the most effective treatments for adolescents with eating disorders for younger ones. It is considered less effective if the onset of the disorder is 18 or 19, but very, very helpful for the early teen girls who actually, I think, are often more troubled and more at risk than the man or woman who has an anorexic episode in college. And in fact, I know, both through my practice and through my friendships, at least 5 women or 6 who had an anorexic episode in college, which means that there's probably twice that many people that I know who just haven't told me, because it's pretty common. But 13, 14, 15 is much more serious. And it's not to scare you if that happened to you, by the way. I'm just saying, as far as clinicians think, you really want to head that off and treat it. And so today I wanted to talk to you a little bit about the work of Salvador Minuchin, who is a brilliant Argentinian psychiatrist, family therapist, which is an unusual combination, or so, who came out with a book called Psychosomatic Families in Context. And I'd be glad to give a link to Jessica to send all of you if you want to look at the book. It's kind of cool. The first 50 pages have a lot about technical things and then research, and then he does 6 case studies. The case studies have a transcript, and it has comments on it, and then an interviewer is interviewing him about the case study that breaks into the case study. So if you want to see how it works, it's great literature, actually, if you want to read it. So what I thought I would do is give you the basic idea and the techniques, or at least the theory behind it. And then I thought I might present to you 3 cases that I've had some contact with over the years that are complicated, that make this less simple. Those of you who are in my lecture course, you know, I do try to make things more complicated because nothing is more complicated than reality. I always worry when people say, when these short-term therapies are pushed. There's something called solution-focused therapy that was really big about 15 years ago. And it was basically like, in 5 sessions, we can just help you to cope. And it's just, I'm sorry, it's just tremendously dumb. So the more a theory or a technique or a clinician acknowledges the complexity of things, the more seriously I take him or her or the idea. That said, I don't want to be overly complicated, so I'll try to strike a balance. All right, so what Salvador Minuchin assumes is that when, let's say, a young girl, although clearly there are boys who have this disorder too, but it's in our culture it tends to be predominantly women, young girls. His idea is that the girl is not having an individual illness. The family is having an illness, and the girl is expressing the illness. What do I mean by that? Well, family therapists love to do genograms, and I will do my best. I'm not a family therapist. I just play one on TV. But in genograms, the squares are the men and the circles are women. So let's say we have a married couple, and they have a son who is 25 and living outside the home. They have a daughter who is just turning 18. She's a senior in high school. And then they have a 14-year-old daughter. And the 14-year-old daughter has started to lose weight, has begun to restrict what she's eating, and she's starting to become symptomatic. They've taken her to a pediatrician who became alarmed, et cetera, et cetera. All right. Let me just say that the 25-year-old is living, let's say the family's in Connecticut. So let's say that he's living on the West Coast. So he's kind of out of the picture. And the 18-year-old is getting ready to leave home. So you're already starting to see some dynamics here, right? Okay. Well, let me make this more complicated. Let's say that mother and father have a somewhat distant relationship. And what a family therapist would do is do this, meaning they're distant and they argue. And let's say that mother and the youngest daughter have a very, very close relationship. Sometimes there's struggles, but there's a kind of intensity about that relationship. And let's say that the 18-year-old has a somewhat distant relationship from mom. In fact, she really won't talk to mom very much. She thinks mom is too controlling, let's just say. Again, we're not blaming mom. The dad is really pretty distant. He has some contact with the son, but let's spice this up a little bit. Let's say that he and the older daughter have a certain closeness. Okay, right? Now, what Salvador Minuchin would say is, let's say the 14-year-old's eating problems become so severe that she's taken to their pediatrician, who does a panel of blood values, electrolytes, and she's looking like she's really in an episode and needs to be hospitalized. And so she is for, let's say, 4 or 5 days. The way that Salvador Minuchin would work is he would first coordinate with the pediatrician and the inpatient unit as the girl became refed. So she would be first on an IV to raise her blood values, right, and her nutritional values. Kept from exercising, kept from vomiting if she also purges, right? And she'd be met with a therapist on the unit who would come in, probably CNL, consultation liaison, you'll know about that soon, read. CNL from psychiatry would come by to meet with her, and they do more consulting. And so let's say she's about to be, well, let's say that she is finally released to go home. What Mnuchin would do is he would meet with the family over lunch. What's that?
It's good to do lunch instead of dinner, because dinners is sometimes a lot more formal.
Exactly. But he would meet with them, and what he would do is he would talk with them about the family, and he would be interested in the degree to which the family is enmeshed. E-N-M-E-S-H-E-D. In other words, does the family, do they let each other talk? There's a great case study he has where there's a family where the boy says that his mom tends to take his voice. And Mnuchin goes, great phrase, what do you mean by that? She'll speak for me. He discovers the whole family, individuals keep speaking for other individuals, putting words in their mouth, correcting them, because they're kind of merged. And so what Mnuchin would do in that case is begin to note what are the dyads, where are the alliances. Like, he might notice that at dinner, at the supper, at the lunch therapy session, mother and the youngest daughter might be sitting next to each other. And there maybe the boy who flew in from the West Coast for this, might be sitting between the parents. Mnuchin will say, I want you to get up and move over here. He switches them around like musical chairs. And he begins to identify where are the alliances. But most importantly, he refers to her as the IP. Anyone know what the IP is? We have to teach family therapy in the school. The identified patient. It's the ironic term that family therapists use for individual
How would
pathology.
you feel about this? Like, how do people normally respond to being singled out this way? Like,
Well, I mean,
if I was a 14-year-old in that situation, I would just go, no. Like, I would.
but you see, but nevertheless, you'd be so symptomatic you're hospitalized, right? So, see, well, that's because you're fierce, which is a good thing. But what I mean is that the world, the family will identify her this way. She's the crazy one. She's the one who's starving herself to death. We're all worried. She's crazy. And so family therapists refer to this person in the family as the quote-unquote identified patient. It's an ironic term. Because the family therapist would say, she's not the patient, the whole system is the patient. She's merely expressing it. I'm sorry? Oh, blow your mind?
Yeah.
Good. That's my job. Yeah, the whole family is the patient. Family therapists don't believe, well, you know how there are orthodox religions and then there are the liberal wing of it, you know what I mean? Like there are Orthodox Jews and then there are like non-observant Jews and there are strict Catholics and there are kind of go on Christmas Catholics. Well, that's true of psychotherapeutic schools. So the Orthodox family therapists would say there is no such thing as individual pathology. It's a myth. They won't treat individuals. They'll only treat families. And they'll insist that you bring people in. There was one family therapist who worked with couples, and if the couple and the family, and if there had been an affair, he would insist that the person, the other woman or man, would have to join the family therapy sessions. But that's extreme. I know. It's California. No.
That would just cause a blow up, though. Like, sometimes it's good to keep things down.
You were speaking for defense and resistance, and I agree with you sometimes it is. But this, I'm sorry?
I mean, it caused a blow up because people found out.
No, the affair itself was
No,
a blow up.
no one found out. No one found out
Oh.
about the affair. Like,
I didn't
it's still a big deal.
say it was secret.
No.
If there's been an affair and it blows up and you're seeing an Orthodox family therapist, he or she might say, I want everybody here.
But like, what if the other person didn't know? They didn't ask to get involved in your like little, powwow of resolutions.
I'm advocating this. I'm really saying what the Orthodox people would do. Look, if I'm less of an orthodox family therapist and I do individual therapy with you, then what I'm going to do is I'm going to continually refer to the family system that you're part of. I'm going to try to get a sense of who are you in alliance with? What role have you been assigned by the family? Family therapists and I think it's a really kind of a brilliant theory, and I just don't have time to teach it in my large lecture, but they believe that a family has a drive toward homeostasis the same way that your physical body does, the same way that the neurons do, right? They believe that the people in the family will unconsciously try to keep the family from changing. The problem is, family's always changing. In fact, there's been some brilliant research. You might like this, my skeptical one. What is your name?
It's Doreen.
Nice to meet you.
Nice to meet you.
There was a lot of really interesting work, and this is related to the Family Life. What is it? The Family Development Center over in Human Ecology, FLDC. Family Life Development Center. Is that still there? Anyway, the notion that a family has a life cycle. So think about when you were 4 years old, and where your family was, and your siblings. And then what happens when you're now 12, and your older sibling is heading toward college, and then when you're 18, and then when all the kids have gone, and then your relationship to your parents as they age. You know, some of them are going to get a dog. They do. So the idea is that the family has a life cycle, and there are pressures that are part of that life cycle, and the healthier, I'm so sorry, all right, let me see if I can, sorry that I'm stumbling a little bit, let me see if I can put this in perspective. All of you in your life, there are certain life stages you're going to go through. You get to divide it by decades, right? 20s, 30s, 40s, 50s, 60s. But what's going to happen in those decades, in your 20s, presumably you're going to find, or you may be wanting to find a lifetime partner, and you're trying to get on a career path toward being a professional something. Let's say in your 30s you decide to have children with someone, you have children with someone. Your parents are now in their late 50s. In your 40s you have kids 10, 11, 12. Your parents are now in their late 60s. Right? In your 50s you're launching your kids, and your parents may be quite old, they may be suffering from Alzheimer's disease, they may be healthy, they may have died already. All of those different stages of life, you're going to find that you're better at some stages than others. There's some people who are really good at being in their 30s. There's some people who suck at being in their 30s. There's some people who really have a hard time getting old. There are other people who just like, hey, finally, great, I'm at the life stage where I want to be at. My view about therapy is you should get individual therapy when a life stage is giving you trouble, when you're not adjusting to it. Some people don't get over the loss of a parent. Some people get depressed after they have children, not just postpartum depression. Some people really have a hard time. Being a parent is complicated, and they didn't expect it. Some people have a hard time retiring, whatever it is. All right, so family therapists would say, where is the family in its development? And also, why is this girl, why has she become symptomatic? Why has she become an identified patient? Why does the family need her to get sick in order to maintain homeostasis? That would be a family therapist question. Well, anyone have a suggestion where you would go if you were a family therapist? Anything up on the board that intrigues you?
I guess how the alliance is formed when they form and how stable they are over time.
Is there a particular alliance you'd be interested in working on first?
I mean, I guess she's really
Well, I think you're onto something, which is that you've got a very close relationship, but the daughter is engaging in a behavior that is terrifying to the mom. And she's asserting her power. I don't have to eat if I don't want to. I don't have to eat. I don't. If I want to get, etc. What about this relationship? What the hell's going on here? Maybe. Now you're thinking psychodynamically, and that's interesting. But a family systems person would say, in what way is this illness keeping the family from moving forward? Because after all, son is already out of the picture. The 18-year-old is leaving home, right? Well, hold on 1 second. Is leaving home, right? And then, what's going to happen in a year? Mother, father, daughter. What happens when daughter gets older? So, is there some way that this symptomatic picture is keeping the family from dispersing on some level? Sorry.
Right, no, that was kind of what I was
That's what you
saying.
saw? You saw it?
Especially the brothers coming back from the West Coast. That's,
Having to fly back to help his sister, right?
yeah, and it might be parents working together as a team or because they're unifying to help their daughter.
Well, a family therapist would have sessions with the parents and get them to explore their marriage. What happened? What happened? Are there long? You know what happens to couples when they're disengaged like this? It's because the resentments build over time. It's like I tell couples I work with. It's like your relationship is like a garden. You have to weed it every day. The moment you say, he's just a jerk, you say it or you say, she's such a bitch, or whatever it is. After a while, then you stop being affectionate, then you start kind of jabbing at each other, and then you stop having sex, and then you start having different hobbies, and then suddenly there's this weird, right? And yet the dependence persists. So let's say the therapist was able to work with the parents individually, as a couple that is, to help bring them closer. At the same time, you would want, in a way, to try to build the relationship between the daughter and the father and somehow sort of reduce the intensity of the struggle with mom. Have the father and daughter do things together. Send the parents away on a weekend where they can be by themselves. And what Minuchin found over time is that if you could strengthen this alliance, give voice to her fears and her feelings and her anger, because anorexic people are both very anxious and they're pretty angry. Which is not a bad thing to be angry. It just has to be expressed, right? If the idea is if the family structure can adjust to the change so that the marriage is intact, the 18-year-old can leave home, and the 14-year-old can turn 15, 16, and feel that she's allowed to leave, then her symptoms will go away. And this is what they found over and over again. Even though it's very different families, and it takes a pretty brilliant person to be a great family therapist, but it's what they found year after year. It doesn't work with every family, but... So, it's a radical idea. She's not sick. She's expressing illness for the family. Any questions about that? So that's part one. Yeah.
I know it's like sort of reacting to the whole like family dynamic and trying to bring people in closer. But I know that a lot of people also talk about, I guess, I don't know, disorders in the sense of like wanting attention as like not getting enough attention. And I don't know if it could be, like, the 25-year-old is off doing his own life. His parents must be like proud of this guy who's matured and started his own life. And then the 18-year-old is going on to college, so there's all this like attention on her applying to schools or getting into schools, and she's just like this 14-year-old that is like struggling through the first year of high school but doesn't get all that attention.
Agreed, but what an unhealthy way to get attention. I I mean, after all, actually, she's going to be getting lots of attention. She'll be the last one home.
Right.
So she can get her parents to herself.